So this is my 1.5 month update since I started taking Strattera, and ultimately I really just had to stop taking it. So I'm going to get into the dose that I started taking when I first started taking Strattera, the dose that I ended on, and some of the things that I experienced throughout the time that I was taking Strattera. So the reason why I was actually taking Strattera was because previously to taking this medication, I was taking stimulants, which were working out pretty fine for me, but I was not taking them every day. I would take them maybe 2 to 3 days a week. And I had a appointment with my doctor, and I explained this to her, and she was asking me why I was only taking it 2 to 3 days a week. And I told her because I didn't want to get to the point where I was depending on it and the medication would eventually get less and less effective and I would have to take more of it. And I did not want to go down that road. I was not experiencing any of those symptoms. This was mainly just a preventative measure. And she asked me all of the questions that she normally asks me for every single appointment that I go to, which is, how's your sleep? How are you eating? Are you feeling any stress or anxiety, depression, or anything like that? And the answer to all of those questions was I was doing really well. But when she asked me about focus and concentration, I said it was really bad, and I only really had good concentration when I was taking my medication, which was, again, those 2 to 3 days a week. So she said, well, don't you want to have focus and concentration every day of the week? And I said, absolutely, that sounds like a great idea. So for that, she made recommendations on some medications that I could take and asked me what I wanted to do. Eventually, we landed on Strattera, and I started out with 25 milligrams. Now, I would say the first few days, I didn't really feel a whole lot of symptoms or anything changing, but after that, I would say maybe even after the first week, I did have a little bit of increased focus and concentration, but I was also feeling a lot more tired. Now, what would happen is I would get a full 8 hours of sleep, and I would wake up feeling tired in the morning, and I would have to take a lot of caffeine. And even throughout the day, I was taking a lot of caffeine. I probably was taking between 400 and 500 milligrams of caffeine per day because I was so drowsy and tired from taking this medication. However, I continued to take it because I read that eventually this goes away. Now, I experienced these symptoms for an entire month. So at that point, I was kind of deciding that it wasn't going away. And another thing that I was experiencing is, although I was getting roughly between 7 and 8 hours of sleep per night, I would wake up a lot at night, maybe 2, 3, 4 times at night, even for like 2 to 5 minutes each time. But I wasn't having those nights of sleep where I would just sleep the entire way through. So eventually, after that month, I had my next appointment where I went to see my doctor, and we went through that entire process again, where she was asking me a bunch of those questions. But this time, my concentration and focus was actually a little bit better since I was taking this medication every day. However, for me, it kind of canceled out since I was so tired every day that I didn't actually want to even do anything at all. So she recommended that I go a step up in the dosage. So she prescribed me 40 milligrams, and I started taking that. Now, again, for the first few days, there weren't any changes. But I would say after the first week, the only thing that happened was I was feeling extremely tired and drowsy now. Whereas previously it was just kind of tired and drowsy. It was a bit annoying. This time now, while I was going to work, I was extremely tired even before lunchtime. And these weeks were pretty brutal to get through. I was waking up tired, midday I was tired, and when I got home from work, I was tired. So basically I wasn't doing anything else but just going to work, coming home, eat, shower, and then go to sleep, and then do it all over again the next day. And this was really tough for me as somebody who likes to work on creative projects. I had zero energy for any of that at all. Now, when I went to that second appointment before my doctor actually prescribed me the higher dose of medication, I was explaining that I was tired, but she actually said that it might be because you are not taking stimulants anymore. And she said that I might just not feel as energized as before when I was taking stimulants, even though I was only taking them between 2 and 3 days a week. So eventually I completely stopped taking Strattera, and I took the 40 milligrams for about 2.5 weeks. So that means that I had another week and a half before going to my next appointment. And during that time period, I was feeling way better. Although my focus and concentration did decrease a little bit, my energy was back. I wasn't drowsy all day. I wasn't feeling as tired, and I didn't need to take as much caffeine as I was taking the previous month and a half. Now, here are 2 things that may be important to consider. I'm not sure, but I'm mainly inattentive. I'm not really hyperactive all the time, but I am inattentive all the time. Another thing to mention is during this time, I wasn't exercising as much as I was previously, so that may have had an effect on my overall tiredness or mood, but I'm not really sure. I just wanted to mention that. So there you have it. That's my experience with taking Strattera. I took it for a month and a half and eventually quit because of the side effects. Now, this is just my experience. This, of course, is not medical advice, and I'm not recommending anyone take any type of medication. Of course, you would have to speak to your doctor about that. But Strattera ultimately did not work for me, and it kind of put me off from taking non-stimulant ADHD medication. If you'd like to see more ADHD content like this, please go ahead and subscribe.